maintain them from hurting themselves, hurting others, and it's just a terrible thing. But with a lot of behavior kids, even kids on the spectrum, autism, um, want to call it Asperger's, whatever. I think in the medical field they keep changing the name. Um, but even but with that, like there are things you can do besides drugs and so forth. To make the kids want to be simple, make them act right. And that is keeping them, you know, accountable, giving them consequences, giving them boundaries. Don't reward them for bad behavior because right now, in all these facilities, they reward bad behavior for kids. And that's not helping. You know, it's destroying them. It's pretty much we're setting them up for failure, and it's very frustrating. Um, Being in the mental health field, because you see that, and it's like and I tell like new people, because sometimes we get these people, they're studying psychology or whatever, and they want to see how things are before they go further in their studies, to see how it is working with people in psych. And so a lot of times they have these rosy with eye glasses and so forth, and they don't realize what they're really going to be dealing with. um, and so I try to tell them the reality of what it is, but also just the fact that you're a lot of times you are dealing with more like behaviors and stuff, and you just don't feed into the behaviors and give them anything they want when they act bad, 'cause that doesn't help them. Like I said, you're setting them up for failure, because in real life, these same kids, you get some very violent kids, disrespectful kids, calling you racial slurs, cussing you out. And I'm talking about kids who are sometimes like 7, 8, and they're calling you, a nigger. They're calling you, um, a bitch. They're like, cussing you out and so forth. And you're like, where are they getting this from? They're usually getting it from their parents, or getting it from TV or something else. And instead of like dealing with those issues, a lot of therapists, and I have nothing against therapists, but because I worked with a lot of great, good therapists, especially at the residential I worked at. But now this, say, hospital I'm working at now, some of the therapists aren't that great, and they try to band-aid the issue, and they try to reward these kids with for bad behavior. And then the kids who are acting fine, who have probably the same trauma, if not more, but because they're not acting out, because you're not being rewarded for the bad behavior, you don't think about them, and they don't get their treatment. You know, um,